today very happy to have Shannon Humphrey, Dr. Shannon Humphrey, in here to talk about cosmetic surgeries, cosmetic treatments.
Yeah,
but there's so many myths around it that some of us are like, fearful, don't change your face. But then there are other ways of really doing things that can help just make you feel more awake or fill in that little blank that has always bothered you.
Absolutely. I think it's about doing little things, conservative things to make you look and feel better about the way you look.
Now let's talk about what you think a West Coaster wants in terms of keeping their face, their skin, their cosmetics up to date and feeling fresh.
Absolutely. The two things that I see most often in my patients, number one is requesting a treatment that looks natural. No one wants to look like they've had anything done. They just want to look a little bit fresher, maybe a little bit more rested or awake. And the second thing is a treatment that's safe. Let's not forget these are treatments that are designed to make us look and feel better. So we want to make sure that they're absolutely, above all else, safe.
Okay, so we all become familiar with Botox. It's sort of like an all-encompassing title for many different products. And you're here to talk about Dysport, which is new to us here, but very established across the pond in the UK.
Absolutely. So Dysport is the #1 injectable neuromodulating treatment in the UK. So it's an injectable treatment that can soften facial wrinkles, for example, frown lines, crow's feet, even forehead wrinkles.
Now you brought some before and after pictures of people who have used this particular product?
Yeah, these are some patients who've been treated with Dysport.
Now this is the most common one.
Yep, she's got the 11s, frown lines between her eyebrows.
That's before. Wow, and how long after is that?
So patients can see results as early as 1 day, but for most patients it's somewhere between 1 and 3 days.
1 and 3 days, and Botox is more like a week.
Yeah, 4 to 7 days for Botox. And it's actually an important thing. Oftentimes patients will come into the office on a Thursday and hope that they can be looking better for a party on Saturday. And so it gives us as cosmetic physicians more choice, more options for our patients.
It might be a situation where somebody wants a one-off as well, or try it. How long does it last though? Like if that's the fear, is if something gets put in the wrong spot and all of a sudden you can't move, or something's droopy, or you don't want that as well. How long might those effects happen?
Absolutely. So Dysport lasts around 3 to 4 months. And for first-time patients, that's often really reassuring. Oh, good, it's not going to last forever.
Right.
But a more common scenario is once patients have the treatment and feel really satisfied with it, they wish it would last forever.
Is there a cumulative effect to the Dysport as well?
We've studied it over multiple treatments, and we know that each treatment offers similar good results to the first time.
All right, and here's the one thing that I asked the doctor about, because we've all seen the lip plump thing. It scares me, seeing little girls that want their lips like Angelina Jolie. Restylane is reversible.
Yeah, Restylane is made of a naturally occurring sugar called hyaluronic acid. And we actually have an eraser. It's called hyaluronidase. So with a simple injection, we can inject hyaluronidase. It dissolves the filler like Restylane, turns it into water, and it's gone.
Is there sort of an age limit for this kind of stuff that you, as a physician, would recommend if someone's watching at home going, my daughter really wants it?
These are treatments for adults, and I think it's important for each physician to assess the patient and make sure they understand the risks, the potential benefits.
Dr. Shannon Humphrey here talking about Dysport and other injectables and things that can help you if you're the right age. This is the message we definitely want to get across here. This is not for everybody. This is for some, and if it's for you, check online. We will have Dr. Humphrey's information on our website. We are going to take a break. It's 8:52. Back in a moment on BT.